Hi, and welcome to Verve Plastic Surgery. I'm Dr. Gupta. I know you are here to see me, and I'll be with you shortly. In the meantime, I wanted to show you this video so that you can go over the main concepts that we will be discussing. After this video, I will be with you, and we will discuss any personalized situations and personalized questions that you may have. Today, I saw that you are here to discuss breast reconstruction after mastectomy. Whether it's a unilateral mastectomy or bilateral mastectomy, the reconstruction process pretty much remains the same, and we will be discussing the various aspects of this reconstruction. The main concept here is that breast reconstruction after mastectomy takes typically 3 surgeries. In some situations, it may take 4 or it may take 2. Right after mastectomy, the blood flow in the skin that is left behind is not very good. And that's why we are unable to put implants directly during the first stage of reconstruction. So to help with that, we start with a deflated balloon called tissue expander. This is what a tissue expander looks like. It's a deflated balloon which has a port in the middle of it. So your general surgeon will go through the mastectomy. He or she will take out the breast tissue but leave most of the skin behind. After your general surgeon is done with their part, I will go in and I will place the tissue expander under the skin over the muscle. The tissue expander goes here and it's tied down to your chest wall through these little tabs with sutures. To help prevent the infections, to keep the breast reconstruction soft at the end, we also cover this tissue expander with a special graft called acellular dermal matrix graft. I know it's a long name, but it's made of cadaver skin, human donated cadaver skin. But it's not an alive graft. There are no living elements. There is no DNA, no proteins, no blood, no cells. We place that over the tissue expander, and the whole thing is covered with your own skin, so you don't see anything from outside. Not only that, within 3 months or so, your body grows into this graft, and this whole graft becomes part of your body. It will have your cells in it, your blood in it. If you did DNA testing, it will be your DNA. On your consent form, you will also see many other things mentioned, such as ActiShield graft, which are some healing chemicals to make you heal faster, stimulant beads, which are some antibiotic beads to help prevent infections, tissue rearrangement, which allows me to rearrange your skin over this whole construct so the final product is well-rounded, well-contoured, and looks beautiful. And finally, you will see SPY imaging. SPY imaging is a special camera that shows me that blood flow in your skin. In 15% of the cases, the blood flow is not good enough to be able to do reconstruction at the time of mastectomy. If the SPY imaging shows that the blood flow is not very good, I may not be able to do reconstruction that day. What that means for you is that we will be doing reconstruction a few months later. It will still be done and you will still have the same result, but reconstruction will have to wait until the skin heals and then we start the reconstruction. In 85% of the cases, we will be able to do the first part of reconstruction, which is the tissue expander placement, on the same day as your mastectomy. So that pretty much is what the first surgery of breast reconstruction looks like. I know you may have more questions, and I will be with you shortly to answer all of those questions. Many patients ask me about the expected recovery times, and I typically say that first procedure, the tissue expander placement, hopefully at the time of mastectomy, is the most involved procedure. And typically the recovery can be approximately 4 weeks long, and you will be given note for your work or whatever you may need to help you through the process. During this recovery, especially during the tissue expander recovery, we advise that for the first week, plan to stay at home, plan to take a lot of rest, and plan to have some help around you. Second and third week is where you will start feeling more independent at home, but you probably will not be driving or carrying out chores outside of the house. Most patients start driving after about 3 weeks, and they will be able to, let's say, carry grocery bags after about 4 weeks. Any more aggressive physical activity like yoga, swimming, sports, and those kind of activities typically are 6 to 8 weeks out. But after your first surgery, you will wake up with 2 drains on each side. So if you're having bilateral mastectomy, there will be a total of 4 drains. Drains are tiny plastic tubes that will come out of the skin right about this area, and they're connected to a special bulb that has markings. These drains typically stay in for about 2 to 3 weeks. And at home, you will need to empty them about twice a day and strip them like this about 4 times a day. While the drains are in there, we also advise that you do not take shower, at least no free-flowing water over the chest. If you have a handheld shower, you can shower below the waist, you can wash your face and hair in the sink, and sponge bath only around the chest. The dressings and the drains need to stay dry at all times. After your first follow-up, you will typically follow up with us once a week. During those appointments, we will be removing the drains, and at some point we will also start expansions. Expansions are 5-minute appointments where you will come in and a needle is placed into this port through the skin, and some saline is injected so that we can fill these expanders little by little at a time. How much? It depends on how big you want to go, how elastic the skin is, and whether you will need radiation or not. So all these factors go into the decision making as to how much to inflate and how much to stretch the skin, and we will figure that out on a case-by-case basis. One other common question here is whether those injections hurt or not. The skin after the mastectomy is actually numb, and that's a permanent change. So little silver lining here is that the needle that goes in, you do not feel that. Sometimes after the expansions, you may feel some tightness on your chest because we just stretch the skin. That tightness lasts about 2 or 3 days, and most patients will just take a Tylenol or ibuprofen, and that's enough. So once this process is done, then we will sit again and have another consultation and talk about in detail the second stage of breast reconstruction. But today I will just give you a little bird's eye view of the rest of the process. But in most cases, the second surgery is about 4 months after the mastectomy. And that will be where we take the tissue expanders out and place the implants instead. Implants will actually give you the right shape of the breast and right feel of the breast. Once that surgery is done, we let the implants settle. And that again takes about another 3 to 4 months. And that's when we will start talking about the final surgery, which typically is any final adjustment of the implants, and also in most cases includes fat injections, where we liposuction some fat from any area on the body, depending on your choice. And we use that fat to inject that under the skin over the implant, so in between the implant and the skin. That gives it even more natural shape and more natural feel, and fills in any nooks and crannies that got left behind. Sometimes during your mastectomy, the general surgeon will also advocate that the nipples be removed. If that is the case, we also try to do nipple reconstruction at that same time. But to recap, first surgery includes tissue expander placement. Then you go through expansions of those tissue expanders in the office once a week, followed by second surgery where we remove the expanders and place the implants. And finally, once the implants have settled into their place, we see what final revisions need to be done, and we combine that with fat injections and nipple reconstruction as necessary. So as you saw, In most cases, if you don't need chemotherapy or radiation therapy, this process can still be about 8 to 9 months long. So we'll be very good friends and we will guide you throughout your journey. My staff and I will do everything possible to make sure your journey stays well informed and you feel comfortable throughout. But during this time, you will be able to return back to work and continue with your life, and on and off you will need the procedures to finish the reconstruction process. Thank you for listening to this video. I will be with you shortly. Please think of any questions that you might have. Please go over the folder that was given to you, and then we will go over your specific situation and your questions.